We want to thank you all for joining us this afternoon on Friday, and we're of course here to share more information with the Long Beach community about COVID-19. I'm also joined by our Chief of Police, Robert Luna, who's going to give a few updates, as well as Dr. Davis, who has been leading our medical response at the Long Beach Health Department. We're very grateful to both of them. We'll go through an update first, and then after the update, we will then answer some questions that have been submitted by the media. And then after those questions have been answered, we will also then do a similar summary of the briefing in Spanish. And Alice is here from the Health Department who will give that briefing in Spanish as well. So I want to thank you. Again, I want to thank you for watching this and for sharing this with your neighbors, family, and friends. Want to begin today by noting that, as you're probably aware, yesterday evening, we received our first confirmation that our first Long Beach police officer has tested positive for COVID-19. Fortunately, this police officer is recuperating, self-isolating at home. But I wanted to share that our thoughts, our prayers, our support are with this officer, with the officer's family, friends, and of course the entire Long Beach Police Department. It is individuals like this police officer, like our firefighters, that are out there as first responders, making sure that people are okay, that they're not just responding to calls and to helping us keep order during this health crisis and emergency. They're also responding to all the calls you would imagine a police officer would respond to on any normal day. So this is a difficult day for the city. We know that we also had firefighters yesterday also test positive for COVID. I'm going to share more information about those firefighters in just a minute. But I want to start by having our Chief of Police give an overall briefing on the police officer and what we're doing as it relates to COVID-19 within the police department. We have the best police department, in my opinion, in the entire country, and it's led by our Chief of Police, Robert Luna. So let me have our Chief Luna give you an update, and then I'll give you some more updates as well.
Thank you, Mayor. Thank you for not only today, but your ongoing support of the men and women of the Long Beach Police Department. So the mayor stated earlier about our police officer, and I got to be honest with you, yesterday I felt like I got kicked in the groin when I was advised that one of our officers had tested positive for COVID-19. And we obviously are very fortunate. We have outstanding leadership in our police department as well as in our city. And we had already prepared for this, so we had a process in place. So when that stress level goes up, obviously one of the first things we want to do is make sure that we're supporting that officer. One of the first things I did is I actually got on the phone with our police officer, and I wanted to hear his voice, and I wanted him to hear mine. And I want to tell our Long Beach community that he is doing well. He is in good spirits. But like, if you can imagine, if you get told that you tested positive, there's going to be some anxiety and there's going to be some fear. And he was no different. But he is resting at home. He's following his doctor's orders. And he is expected at this time to make a full recovery, but we'll absolutely keep an eye on him. One of our other priorities, working with our partners in the health department, is to, as we're doing with everybody who gets a positive test, is to try and find out who they came in contact with. And I can't say enough about our health department, our doctor, our employees. When I was conversing with them on the phone, they understood the priority it was not only to get this officer tested, but to figure out who had been around him. So one of the first things we did is we came in contact with the officer's partner and spoke to him, and we have made sure that that he's quarantined, that he's safe for the next 14 or so days, and he is in good spirits. I've spoken to him, and I can't say enough about these officers and their attitude just towards life. They're amazing people. For police chief, it's important not only to contact the employees, but to reach out to all of the employees. So we immediately, after contacting the employees, we got on the phone, and today I'm used to when there's a crisis in the police department, you go out and you get everyone together. We can't do that today. We're in a different environment. So my staff put together what was like a conference call, and we immediately got as many employees from both the West and South Division patrols. That's where this officer is assigned. And not only told them the most updated information that we had at that time, but gave the employees an opportunity to ask questions, to engage not only myself, the assistant chief and several deputy chiefs and other key executive staff members to answer their questions. And ladies and gentlemen, there are a lot of questions. You have to remember that our police officers are coming to work every day. As we have given our community stay-home orders, our officers don't have an option. They are coming out. They have to be on the front lines. They have to serve our community in the time of need, understanding that there is the risk to their own safety, just like our firefighters and other essential employees are out there, but they come to work anyways. And but we talk to our employees. We're making sure that they're well. Their families are very concerned about them. So for us as a police department, we've made sure that for the last several weeks, even prior to this positive test, that we were ready for this, that we had plans in place. What would we do not only if our employees become infected, but some of our citizens? So we've gotten into extensive planning. And I got to tell you, I wake up at 3 a.m. trying to figure out what did we miss, because employee wellness and their health is a top priority to us. So we want to make sure we're not missing anything. And part of what we're doing, and I'll give you an example, I spent over an hour on a conference call with several major city police chiefs from around the country. And we're learning so much from each other. We're finding out what works, what doesn't, and one of the people on the phone today was a commissioner of the New York Police Department, and to listen to what they're going through right now is actually very amazing, and it's something that we need to pay attention to, and we are, specifically from a police department perspective. And then just to wrap up my statements, and then I will be answering questions, is some of these changes or plans that we have had as a police department, we're looking at them every day. We're looking at, for example, our patrol officers. As they're in the field, how can we limit the contact that they have with our community members? How can we make sure that they are keeping that social distancing from each other, so that we try to impact that curve that everybody's talking about. So we are trying to split up our employees. We are, and to give you an example, when we're getting dispatches, if they're not an emergency dispatch that deals with a violent crime that's occurring at that time, we're giving the officers an opportunity to be able to call the person who called us on the phone and try and handle a dispatch either on the phone or have the citizen come out of their residence, trying to keep that 6-foot distance and trying to handle the calls the best that we can. There's a variety of examples I have of things that we're doing, and not only things that we've put in place now, but just leaving the station now. I have an extraordinary team that's looking at other ways of trying to find mechanisms to keep us separated from people as much as we can. I'll be here to answer any questions that may come up. I'd like to introduce, I'm sorry, I'm going to turn the microphone back over to Mayor Garcia. Thank you.
Thank you, Chief. And again, we're always have all of our police officers and firefighters in our thoughts. Now I want to give an update on our firefighters and some other new announcements that we're making as far as it relates to additional closures and other programs that are happening at the city. I want to let folks know that we've been reporting our firefighter positive number for COVID-19. We actually have, that's increased some, unfortunately, so we are now actually at 13 Long Beach firefighters that have tested positive for COVID-19. That is a high number that we take very seriously. Like I mentioned in the last briefing and has been relayed in the press, most of these firefighters had interactions and were working out of Station 11 in North Long Beach. And so we continue to monitor those firefighters. They are in good spirits. We continue to work with their families, the entire Long Beach Fire Department. We're thinking about and send our love and support to as well. And of course, of those 13, 4 are Long Beach residents, and that's important. Our total account of those positive in the city right now is 70. That's a number that is continuing to increase as it is across the county, and we may have other additional increased counts, and Dr. Davis knows those as well. That number, I say, continues to increase throughout the hours and days. And I want to remind people that just because we put out a number, that doesn't mean that that is the number. It is highly likely there are many more that would test positive. And please, people need to shelter in place and follow directions and orders. Want to also add, in addition to that, the governor has been very clear, as well as the city, with the stay-at-home orders. You can only leave your home if it is an essential place of business or work. We're asking folks to stay home unless you have one of those essential jobs, or unless you're going out walking your dog or going from place to place. Please stay home. This is critical for our hospitals, medical teams, and the city as well. A couple additional announcements. We will be putting out information later today that will align with Los Angeles County as it relates to beaches in Long Beach. I think people are already aware that we've already closed parking lots along our beach. They are open only for residents with a permit that we are producing, but to the general public or to go to the beach, all of those have been closed, including the pier. But later tonight, we will be putting out additional guidance that will align more of our beach closures with what the County of Los Angeles is doing as well. And so those details will be out later, but you can expect that we will be aligned with the county, and that is something that we've tried to do throughout this entire process. In addition to that, I want to talk about parking. What we've announced so far is that we understand that there are a lot of restricted parking areas in the city and restricted neighborhoods. We are offering and continue to offer parking lots along the beach, downtown, and now we will be announcing also soon additional lots, which will be out soon across the city, for people to have parking free of charge with a permit. You can receive your permit by going to Long Beach at lazparking.com. That's an email. You can email that number, email that information. It's Long Beach at lazparking.com. And that, of course, is also on the COVID-19 website. And for those that are wondering as it relates to parking, we will also be announcing later today additional relief. As folks are aware, last week we did not have citations as it related to street sweeping. This week there are no citations as it relates to street sweeping. We want the community to know that that is going to be also extended beyond this week because we are trying to come up with the best parking management plan possible. Street sweeping is going to continue, but we're looking at ways of not having to cite people that can't move their cars. We know that's important, but we also want people to know that we have to clean the streets. And so look out for additional information. The city will be putting out official information on the length of an extension of that citation holiday, and that should be coming out also in the next day or so for the community to know. So please note, and please reach out to get your parking as well. Want to also remind folks that the stay-at-home order is in place. Our hospitals are asking us to do everything we can to keep our nurses and hospitals and doctors safe. And I also want to mention, before I turn this over to Dr. Davis, 2 additional programs that are right now out and that the community can be involved with. I want to share that, and this is good news for us as a community. The first thing I want to share from a good news perspective is we have launched our disaster relief fund for COVID-19. You should all be aware of that. You can go to longbeach.gov to donate, and that's run through our nonprofit network and is going to really great organizations. So we encourage you to give to that program. The Long Beach Health Department is also partnering with neighborhoods to create these Hello Neighbor cards, and a lot of community organizations are also creating them. These cards are a partnership and really the brainchild of a group also called We Love Long Beach, who started creation of these cards. They're a wonderful organization across the city, and we're adopting their model. And these cards are available at the COVID-19 website at longbeach.gov in English, Spanish, Khmer, and Tagalog. And you are able to share these, put these on doors, and allow people to know that you could help them with groceries, with errands, especially for seniors and vulnerable communities. And they're in multiple languages. So that is also a piece of good news. And the other last piece of good news I will share is you probably saw on the news this morning that the United States Navy ship, the Mercy, has docked in our neighboring port, the Port of Los Angeles. This is amazing news for the region and for Long Beach and local hospitals. This is a 1,000-bed floating hospital with 800 medical personnel and other personnel on board. What this ship will do is it will relieve the stress of the other hospitals, not just in LA County, but also here in Long Beach. And so that will allow places like Memorial or St. Mary's or all the hospitals around Los Angeles and the county to send patients that are not COVID-19 positive and that are not sick with that virus, but other types of medical needs to clear beds in our hospitals for the most serious of COVID cases. And so we're very grateful to Mayor Eric Garcetti, to our supervisors, to the entire team at the county, to the governor, and all the way through to the president and the administration, everyone together, the entire system, and especially the United States Navy. We want to thank you for this amazing work. I want to also just say, finally, that Dr. Davis is doing an amazing job of leading our health response, and she wants to give some additional updates on what's happening through the health department. Dr. Davis.
Thank you, Mayor Garcia. So I want to begin by acknowledging the sacrifice our public safety officers make every day. Police officers and firefighters are critical in ensuring our city's safety and wellness, along with so many others who provide essential services. We also appreciate the sacrifices that so many of you are making by staying at home, by distancing yourself from others when you're at the grocery store or picking up takeout food from restaurants. While this is a tough situation, having residents stay at home is a valuable tool to protect our first responders and others, like our seniors, for instance. While we're here, I want to share some resources available to older adults. This week, the Health Department established a special resource line for older adults and persons at high risk of illness who are self-quarantining at home and in need of resources. If you're an older adult who is self-quarantining at home and in need of support, or if you have a loved one who needs support, please call our info line, which is 562-570-INFO, and select option 5. That's 562-570-INFO, or 4636, and select option 5. The line is staffed Monday through Friday from 8:30 a.m. to 5 p.m. The resource line will connect callers to one of the city's social workers, health educators, or librarians to help people connect with resources like food delivery, home supplies, prescription delivery services, utility restoration, mental health resources, or friendly caller programs to help those feeling socially isolated. This resource line does not provide medical advice. For general COVID-19 related questions, callers should select option 2 instead when calling 570-INFO. I also want to share a resource available to anyone who is feeling anxious and wants to speak to someone directly. You can call the Access phone line 1-800-854-7771. The Access phone line is run by the Los Angeles County Department of Mental Health and provides mental health screening, referrals to service providers, crisis counseling, and linkages to other resources. Callers can get assistance in English, Spanish, and other languages. The number again is 1-800-854-7771. People can also text LA, the letter L-A, to 741-741. That's LA to 741-741. We are concerned about everyone's total wellness, not just preventing COVID-19, but your mental health as well. So please take advantage of all the resources that are available. And as always, I remind you to take measures to protect yourself and others. Wash your hands, don't touch your face, disinfect high-touch surfaces on a regular basis, cover your coughs and sneezes, keep your social distance. Please continue to stay informed and up to date on COVID-19 by visiting www.longbeach.gov/COVID-19 or by calling our COVID-19 info line at 562-570-4636. You can also follow @Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you.
We
We're
have
gonna-
some
we'll do
additional
some
questions that have come in. We'll start with Dr. Davis. Dr. Davis, we've had several questions concerning how many tests are currently available in Long Beach, as well as if you can explain the testing criteria. There is a concern that people are being denied testing because of limited capacity.
So thank you for that question. And let me just make sure I have all the pieces of it. So we want to know how many
tests
number of
are there
tests.
available?
Uh-huh.
And is the number of tests available causing people to be denied testing?
Okay, denied. So there are thousands of tests available in Long Beach. There's several different avenues to get testing in Long Beach, including the Long Beach Public Health Lab and commercial labs such as Quest, ARUP, and LabCorp, among others. There is limited capacity throughout the nation. There's several steps to testing somebody, and each of those steps, there is a limited capacity. That includes the reagents or the laboratory testing supplies, the swabs that you need to get the sample, the personal protective equipment that you need to wear in order to obtain the sample. So that is a reality. However, if you need to be tested, there is a test. You are able to get a test. What we're asking is that if you have mild illness, that you stay at home and you don't necessarily need to be tested because it's not going to make a difference in what happens for you for the illness. You still need to stay at home. You need to take Tylenol for your fever. And so knowing whether the test is positive or negative doesn't change that. And we know that COVID-19 is in the community. So there is a likelihood that those symptoms that you're experiencing are because of COVID-19, and you just need to kind of take the steps that are necessary. But if you are hospitalized or you're an ill or sick exposed healthcare worker, then we will be prioritizing you for testing, but everybody else who needs to have a test can have a test in Long Beach.
Last question for Dr. Davis. Orange County does not have the same orders as LA and Long Beach. With Long Beach sharing a boundary with Orange County, does that affect our city's ability to slow down the virus? Since Orange County has different sets of orders.
I think we all are following the CDC guidance, so we all have the same goal, which is to limit the spread and transmission of this virus. We all communicate and talk over goals on a regular basis. So I do feel like we're all in the same boat, if you will. We all have slightly different environments that we're working in, and so we all are kind of using what tools that we need. But we definitely will align with our neighboring jurisdictions.
Thank you. Mayor Garcia, will the timeline for utilities shut-off suspension be extended past March 30th?
The utilities?
The utilities.
Yeah, I think that we're always announcing and pushing dates forward depending on what we're reviewing. I would say that it's not our intention to shut off anyone's utilities during this crisis because they can't pay. And so whatever we need to do to make that happen in the weeks ahead, we're going to do. So we'll have more announcements about utilities and parking and other types of ways to bring relief to residents in the weeks ahead. I want to add one thing that Dr. Davis said about testing. Just want to make sure, because Dr. Davis is absolutely right. The Long Beach Health Department and our hospitals are following the CDC recommended guidelines as to when to test and who to test. And so I understand there's a lot of folks that just want to get tested, because I understand that. I hear from people. But our departments are doing and following those guidelines very carefully and very rigorously. There's been questions about drive-through testing systems or other types of testing systems. We will have, I think, some larger announcements around testing in the near future. We're hoping in the next day or so we'll be able to share some more information about testing so that people really understand as we move forward in these next critical weeks what some of the options are. And so we hope that that's coming in the next day or so. And so we'll have more for residents on that. But right now, when a case is serious enough that reaches that CDC guideline, Long Beach is providing that test.
Mayor, when additional questions come in, are officials concerned about the local hospital capacity?
Absolutely. We're absolutely, it's my biggest concern right now, to be honest. I don't think there's anything that I'm concerned about more than the capacity of our hospital beds. And we're talking to our hospital leaders, to the nurses that are on the front line, and everyone is concerned about the amount of beds. That's why the United States Navy Mercy being here is a huge relief. That's why it's a huge relief that we are reopening Community Hospital. I was on the phone earlier this day multiple times with the leaders that are opening that hospital up. And I will tell you that one thing that I'm very grateful for is Governor Newsom. Governor Newsom, who I've been communicating with, is being very supportive right now of all of our cities, but I would say of Long Beach as well, especially. And it's because of his work that we've been able and are able to get Community Hospital back open. He's ensuring that we have the resources that we need. He's ensuring that our hospital beds, that we have mobile hospital opportunities. And so we're going to continue to increase capacity, but we're going to do what we need to do on our end. And that means that the public and all of us have to do our responsibility, which is stay at home and stay healthy.
The next question is for Chief Luna. Chief Luna, the question is, are other officers or employees being tested within the police department?
Yes. We currently have about 6 employees under quarantine and some that are being tested. So hopefully we'll get those results as soon as possible. And you always pray that they come back negative, but if they don't, as I stated earlier, we have a process in place that deals with those eventualities.
Chief, another question that came in during the squad meetings while the officers are getting ready to go in the field. Are you asking them to separate more than usual in their briefing room?
Yes, we've asked each commander in each quadrant in the city that when they are having roll calls, whether it's officers getting dressed, to really practice the social distancing that we're asking all of our community members to practice. For example, in West Division, at one point we had a combined South and West. We've asked both divisions to separate and do it at different times. And again, trying to be as creative as we can as we move forward. We're actually making some plans to potentially change some shifts around if we have to. Anything we can do to keep our employees healthy.
Chief Luna, another question came in regarding the crime rate. How has the coronavirus crisis impacted the crime rate in Long Beach?
For the month of February, actually, as the mayor has spoken about before, Long Beach continues to have reductions in crime overall. But as of February, our overall Part 1 crime was down by over 5%, and our violent crime was down 7%. We are looking at crime every day to see what the impacts of staying at home are. or people very concerned about the financial or economic situation around us. We did note, for example, that this last week, our residential burglaries dropped about 35%, probably because more people are home. But our auto burglaries did sneak up some, so we're obviously keeping an eye on that. In regards to shootings and things of that nature, we're still responding to those in this time of crises. And our calls for service are basically flat. We are noticing that from a lot of police departments around us, they're saying they're having a dip in calls for service. But we're seeing ours flat, but we'll continue to look at those and evaluate those. Last week, we did have seven different robberies that related to marijuana deliveries. So we're keeping an eye on that to see if that's a trend, but we did arrest the suspects involved in that. But we then had another commercial burglary involving marijuana.
Thank you very much. That's it for our questions.
Thank you. I'm gonna turn this over to Alice here, who's gonna give our Spanish version. But before I do that, I also want to just note, this is Paola, who's behind us doing interpretation for American Sign Language, and we have different interpreters that join us at these. And I just want to thank her. She's been with us a lot, and as others have. She's doing a really great job. And so when you think about all the people that are working, they're strong public servants, I also want to thank not just Paola, but all of the interpreters that you see interpreting for so many across the state and the country. So thank you to Paola. And with that, I want to turn it over to Alice.
Thank you. Gracias a todos por acompañarnos esta tarde. Hoy estamos aquí a compartir más actualizaciones sobre el estado actual de COVID-19 en Long Beach. Ayer por la noche recibimos confirmación de que el primer oficial de policía en nuestro departamento de Long Beach dio positivo por el COVID-19. Desde entonces, él está en su casa recuperándose bien. También le han dado un examen a su compañero de trabajo y el capitán Roberto Luna ha estado aquí hoy también para darnos los antecedentes sobre cómo está haciendo la estación de policía para proteger a sus empleados y a la comunidad. Y desde entonces también para toda la ciudad, ahora nuestro número de casos es 70 para la ciudad de Long Beach, y este número está incluyendo al oficial. Queremos enfatizar nuevamente la importancia de que todos y cada uno de nosotros hagamos nuestra parte para detener la propagación de este virus y obedecer la orden más segura en el hogar. También queremos reportar que ahora son 13 bomberos que han tenido un examen positivo del COVID-19, y todos han sido de la misma estación de North Long Beach, estación 11. También queremos ahora recordarles que las playas están cerradas. Más información esta noche con detalles sobre la cerradura de las playas. Queremos también dar unos datos sobre que la doctora Davis, la directora del Departamento de Salud, y quiere nomás reconocer el sacrificio que hacen nuestros oficiales de seguridad pública todos los días. Los oficiales de policía y los bomberos son críticos para garantizar la seguridad y el bienestar de nuestra ciudad, junto a tantos otros que brindan servicios esenciales. Más importante, tenemos una línea nueva que está disponible para nuestros mayores. Mientras que estamos aquí, quiero compartir algunos recursos disponibles para los adultos mayores. Esta semana, el Departamento de Salud estableció una línea de recursos especiales para adultos mayores y personas con alto riesgo de enfermedad que se autoponen en cuarentena en el hogar y necesitan recursos. Si usted o un adulto mayor que está en cuarentena en casa y necesita apoyo, puede llamar a la línea de información del 562-570 INFO, y tiene que escoger la opción que es el número es 562-570-4636 y selecciona la opción 5. La línea se encuentra abierta de lunes a viernes de 8:30 de la mañana a 5 de la tarde. So, por favor, tome nota y pueden usar esa línea para alguna persona que esté en el hogar ejerciciando la cuarentena para cualquier persona que conozca a sus familiares o a sus vecinos. También tenemos otro dato de que está el Hospital Naval en el puerto y ese hospital va a estar disponible con 1,000 camas y 800 personales médicos para nuestra ayuda, pero esas son para personas que no están infectados con el COVID-19. Esas son para otras personas que necesitan atenciones médicas para poder aliviar todos nuestros hospitales en la ciudad de Long Beach. Por ahora, nomás recuerden, queremos y respetamos todas las personas que están respetando la cuarentena y por nosotros que tenemos que trabajar por los trabajadores esenciales, es muy importante solo de su casa, su trabajo y nada más. Muchas gracias.
Y muchas gracias a todos que están mirando hoy día, and thank you all very much for joining us. And again, have a safe weekend, stay healthy, and we will see everyone next week, but also continue to put up messages. So thank you.